My name's Natalie Stinton. I am the chair of the Oral Medicine and Maxillofacial Surgery Department and the program director for the pediatric dental residency. So I matched here for my residency in 2011 and then stayed on as an attending in 2013. I took on the program director role in 2018 and then the chair role in 2020. I knocked out my front tooth when I was only 16 months old, so it was a baby tooth, luckily. But there was still the mark on my windowsill that was there growing up in that house. I'd see it every day and know, like, oh, that's the spot that my tooth made. And my parents would tell me how worried they were when that happened. I had a really great dentist growing up, and they managed it appropriately, and I wanted to be that person for somebody later on. So most of my time is spent with my 4 boys. I have a 10-year-old son, twin 7-year-old sons, and a 4-year-old son. So they keep me busy. They're all in a lot of athletics. They do a lot of sports together. So I'm helping out with their practices. I'm playing with them in the yard. We just got a dog, so we're also a male dog. So I'm surrounded by males at home. But we spend a lot of time just goofing off, having fun, and a lot of time outside. I have such great memories of my parents growing up, and the times that they made me laugh and spending time together, and those relationships don't develop just by chance. You really have to put in the effort, and it's not about the total amount of time you have, but the quality of the time that you have. So they know that I'm invested in their well-being and their activities, and I know all their friends, and I think having that allows conversations to be easier with them, and just for us to really enjoy each other's company growing up. I think the best part about Geisinger is really the hospital system as a whole and how all of the providers can interact together well. There's no, one department's more important than another. Everybody kind of realizes they're part of the healthcare team and work together for the good of the patients. I think that it attracts a type of person who really wants to build something and be part of developing something new, like a new program and offering a new service that you're really making a difference, because if you weren't here in that role, then nobody else would be able to offer it or get that. The patients wouldn't be able to get that care in their hometown. So I think having a wide group of people with that same sort of mindset really promotes this culture of growth and learning and education that really does attract a lot of people who have that caliber of similar interests. I think, it really is what has kept me here, is knowing the difference that I'm making, and that if we weren't here, the residency program wouldn't be here, that we wouldn't be able to touch all of these lives as training years go on, and being able to offer trauma services for patients who, have had a traumatic injury in the middle of the night, and they're so worried about what's going to happen to their smile, and the fact that we can have a part in building their confidence again and help getting them care it's really meaningful to me.